Here's a detailed breakdown of how we address hydrogen sulfide SIBO, or an overgrowth of hydrogen sulfide producing bacteria in the small intestine, and the abdominal pain, bloating, and diarrhea or constipation that often comes with it. My name is Bella, and I'm a functional nutritionist and founder of the Functional Gut Health Clinic, where we help clients with SIBO and other digestive conditions take back control of their gut health. Welcome back to our SIBO series. In this video, we're diving into our holistic and comprehensive approach to addressing hydrogen sulfide SIBO, or ISO, Intestinal Sulfide Overproduction, as it has been recently renamed. Here's what we'll be covering: the best and worst foods for managing symptoms quickly, our top natural antimicrobials to effectively target small intestine bacteria, and essential tips for supporting your microbiome, enhancing digestion, detoxification, and preventing relapse to maintain balance in the small intestine. Let's break down our SIBO framework. So you will remember that there are 3 different types of SIBO. But what you may not realize is that while our overall approach is consistent, the details vary depending on the type of SIBO you have. For instance, diet changes are crucial for all types of SIBO, but the specific foods we recommend can be very different. The same goes for herbal antimicrobials. What works for one type of SIBO doesn't work for the other. But here's our key takeaway. Our approach goes beyond just diet and antimicrobials. These are important, but they often aren't enough, especially if you have high gas levels or if past interventions haven't worked for you. After working with hundreds, if not thousands of SIBO clients, we've discovered that a comprehensive approach is essential. It's not just about clearing the bacteria. It's about doing so in a way that sets you up for long-term relapse prevention and fits into your daily life. Let's break down our comprehensive approach to addressing SIBO, which is divided into 2 key phases. Phase 1, eradication, and Phase 2, relapse prevention. We follow this method because studies show that relapse rates for SIBO can reach as high as 45% within the first year if not properly managed. Within Phase 1, where we work towards SIBO eradication, we'll cover diet strategies to support the eradication process, effective natural herbal antimicrobials and the elemental diet, the role of pre- and probiotics for microbiome support, as well as essential supports for detoxification, drainage, digestion, and very importantly, small intestine motility. And finally, we will touch on why it's crucial to identify the root causes of SIBO to prevent future relapse or reoccurrence. If you're dealing with hydrogen sulfide SIBO, the quickest way to get your symptoms under control is to adjust your diet. Let's dive into how your diet plays a crucial role in your SIBO healing journey. While diet alone will not eliminate a bacterial overgrowth, studies show that SIBO diets can reduce symptoms by 60 to 90% depending on the specific diet you choose. As you can see, diet changes are a powerful tool, but it's important to follow a restricted diet for only as long as necessary to avoid any long-term changes to your gut microbiome. Our diet recommendations are tailored to each individual, but our general approach for hydrogen sulfide SIBO is very similar to hydrogen SIBO. The key is to reduce fermentable carbohydrates because overgrown bacteria ferment these carbs into gas, leading to bloating, pain, and other uncomfortable symptoms. For clients with severe symptoms, we often recommend more structured diets like the SIBO biphasic diet or the SIBO specific food guide, which can reduce symptoms by up to 75 to 90%. These diets are effective because they not only specify which foods to include or avoid, but also highlight the importance of portion sizes for symptom management. So for instance, a small amount of sweet potato might be okay, while a larger portion could contribute to symptoms, depending on your overall fermentable fiber intake for that day. If you've been on a strict diet for a while and you need more variety, a paleo-style diet might be a better option, especially if you don't require as much carbohydrate restriction. Other less restrictive approaches include the specific carbohydrate diet, or SCD, GAPS, or gut and psychology syndrome diet, low FODMAP, fast track diet, or the CEDARS low fermentation diet. Each of these options needs to be customized to your specific needs. So by reducing fermentable fibers and increasing fats and proteins, many clients start to feel better. Sometimes this is all you need for temporary symptom relief with hydrogen sulfide SIBO, but for other people, further adaptations can be key to reducing their symptoms. So here are a few additional SIBO diet recommendations we give to our clients starting phase 1 of our framework. Interestingly, sulfur intolerance isn't always present with hydrogen sulfide SIBO, and while some clients need to avoid sulfur-containing foods and herbs, others tolerate them just fine. We have found that specific high sulfur foods like onion, garlic, kale, eggs, and chicken, and especially leftovers with chicken in them, are often problematic for our hydrogen sulfide SIBO clients. For these people, temporarily removing those foods and then slowly reintroducing them after antimicrobials are finished can be really helpful. Another recommendation we make for all of our clients is to aim for about 70% cooked and 30% raw foods. So cooking vegetables reduces their fiber and resistant starch content, making them less likely to cause symptoms. It's also important to make sure fruit is fully ripe, since underripe fruit is high in resistant starch, which can lead to symptoms. And finally, we like clients to focus on meal spacing, so leaving at least 4 hours between meals allows the migrating motor complex, that cleansing wave in your small intestine, time to clear out the bacteria and food remnants, helping to reduce bacterial overgrowth. During this time, it's crucial to limit alcohol, caffeine, and artificial sweeteners because these can disrupt small intestine motility and encourage bacterial growth. Are you ready to take on hydrogen sulfide SIBO? Let's jump into the best strategy for clearing out this type of bacterial overgrowth in the small intestine, using natural herbal antimicrobials. Remembering our SIBO framework, you'll notice that antimicrobials fall under the second part of phase 1, eradication options. These herbal supplements act like nature's antibiotics, but with less of a hit on your beneficial gut bacteria. They also target other opportunistic overgrowths and tend to be gentler on the gut, which is why they're our go-to choice for eradicating hydrogen sulfide SIBO. The science and clinical practice is still evolving, but at present, single antimicrobials are our preferred eradication option for hydrogen sulfide SIBO. Right now, our clients are having great success with 4 weeks duration, regardless of gas levels and the rise detected on testing. I can think of only a couple of clients to date who benefited from a second month. It's important to remember that specific brands and dosages can vary, so always consult with your healthcare practitioner before using natural supplements. That said, here are the herbal antimicrobial options we currently prefer for hydrogen sulfide SIBO. The first is bismuth, second is high-dose oregano, and third is Ursi and silver hydrosol, but they come with several precautions. We don't recommend using this combination unless you've thoroughly reviewed all contraindications with your qualified healthcare practitioner. Let's start with the basics of bismuth. Bismuth is an antimicrobial that helps reduce populations of hydrogen sulfide producing bacteria, also known as sulfate reducing bacteria. Bismuth also binds to hydrogen sulfide gas, which makes it a really good choice for reducing symptoms. Currently, bismuth seems to be the most effective intervention we have, but our understanding might evolve as more research becomes available. In the context of hydrogen sulfide SIBO, bismuth is typically used in the form of bismuth subnitrate and bismuth subsalicylate. Our clients prefer bismuth subnitrate at 400 to 800 milligrams daily. We source this from Priority 1's Biofilm Phase 2 Advanced, a product that not only provides bismuth subnitrate, but also acts as a biofilm disruptor, giving you 2 benefits in one. An alternative to bismuth subnitrate is bismuth subsalicylate, which contains salicylates. Unfortunately, many of our clients find salicylates hard to tolerate, and you might recognize bismuth subsalicylate as the active ingredient in Pepto-Bismol if you're in the US. For clients who choose to use this alternative, they aim for a daily intake of 2,000 milligrams divided into multiple doses throughout the day. Next up, let's talk about high-dose oregano. So oregano works specifically at reducing populations of hydrogen sulfide producing bacteria. For clients who are experiencing significant symptoms, we often pair oregano with bismuth. The combination not only targets the bacteria, but also helps bind hydrogen sulfide gas, providing that additional symptom relief. It's important to remember that oregano is a potent antimicrobial herb, so it should be used with caution, especially if you have a depleted gut microbiome. Biotics ADP oregano is a dried emulsified product that we've seen really good tolerance and outcomes with. Our clients do well with 250 milligrams 3 times daily for 7 days, if they can tolerate it. And then after that, they reduce the dose down to 150 milligrams 3 times daily for an additional 3 weeks. That gives you 4 weeks in total. Finding emulsified oregano or other high-quality versions of these products can be tough, which is why we've set up our full script dispensary offering a 20% discount off regular retail prices for anyone in the US. We want to make sure that you have access to the best resources for your healing journey. And if you're interested, you can check out the link in the description. And please remember, always consult with your healthcare provider before starting any new supplement to ensure that it's the right fit for you. Did you know that about 75% of bacterial infections involve biofilm? Biofilms are colonies of microorganisms that are protected by an extracellular matrix, so it's sort of a shielded home for the infection. This barrier can make the infection up to 1,000 times more resistant to antibiotics, making it much harder to eliminate. That's why incorporating a biofilm disruptor into your SIBO protocol is crucial, especially if you're using antimicrobials to address the infection. Using specific herbal products to break down biofilm at the same time as taking antimicrobials can significantly improve the effectiveness of this intervention. Many of our clients have had great success with biofilm phase 2 advanced by priority 1. This product combines bismuth with other biofilm disrupting ingredients, making it a powerful 2-in-1 tool for hydrogen sulfide SIBO. Could one of our SIBO eradication tools designed to help heal your gut actually be making things worse when you have hydrogen sulfide SIBO? This can absolutely be the case for the elemental diet. The elemental diet is a liquid diet made up of pre-digested nutrients absorbed in the upper part of the small intestine. It basically starves the overgrown bacteria in the lower part of the small intestine responsible for SIBO, while still providing the nutrition for the person. The elemental diet can be used as an alternative to natural herbal antimicrobials. However, when it comes to hydrogen sulfide SIBO, its use becomes controversial and potentially problematic, mostly due to its sulfur amino acid content. Hydrogen sulfide SIBO involves an overgrowth of bacteria that produce hydrogen sulfide gas, leading to symptoms like diarrhea or constipation, bloating, and abdominal pain. These bacteria thrive on sulfur-containing compounds, including amino acids like cysteine, taurine, and methionine, which are unfortunately common ingredients in elemental diet products. The problem is the increased availability of sulfur. So elemental diets rich in these amino acids can provide hydrogen sulfide producing bacteria with the fuel they need to make more gas, potentially worsening symptoms instead of reducing the bacterial load. So taking this into consideration, we aren't currently recommending the elemental diet for clients with hydrogen sulfide SIBO. Our current clinical experience is that a more effective approach for these clients involves a low sulfur diet combined with antimicrobials. This strategy limits the sulfur available to these bacteria while actively reducing their numbers. Supporting detoxification pathways, especially those involving molybdenum, can also help process hydrogen sulfide more efficiently, so I'll touch on this very soon. So my key takeaway here is that while the elemental diet can be effective for other types of SIBO, it's not our preferred approach for hydrogen sulfide SIBO due to the risk of worsening symptoms. Unfortunately, there isn't a lot of research or clinical experience to help guide us with the use of pre- and probiotics for this relatively new discovery of hydrogen sulfide SIBO. Right now, we're all in the process of learning through research, trial and error to identify the best strategies for microbiome supports. In general, we haven't used a lot of pre or probiotics with hydrogen sulfide SIBO clients, but there are some recommendations we consider, especially for clients who need additional support with symptom management and for supporting their beneficial gut bacteria if levels are trending low. Looking back to our SIBO framework, you can see that microbiome supports are the third element of phase 1 and include both prebiotics and probiotics. So let's talk through prebiotics first. Most prebiotics are typically not well tolerated when you have SIBO, mostly because they feed up bacteria, which when you have SIBO are already overgrown and driving a lot of symptoms. So why would we consider using them? Well, there is a specific prebiotic called galacto-oligosaccharides, or GOS, which has been shown in the research to reduce hydrogen sulfide gas production. If clients choose to give GOS a try, they typically start with it after 2 weeks on antimicrobials, and they titrate it up slowly over a few weeks to 5.5 grams daily. Let's discuss probiotics for hydrogen sulfide SIBO next. We mostly use probiotics as a part of SIBO protocols to help with symptoms. Unfortunately, there isn't a lot of research or clinical support for the use of probiotics specifically for hydrogen sulfide SIBO yet. That said, back in 2014, a specific probiotic strain called Lactobacillus plantarum LP8 was researched extensively, and they found that a single daily oral dose of LP8 for 4 weeks showed an increase in bifidobacterium and other beneficial bacteria, whereas Desulfur vibrio, one of the main hydrogen sulfide producing bacteria in SIBO and other opportunistic pathogens, decreased. Unfortunately, we can't get this specific strain in a supplement yet, but our clients have been using Lactobacillus plantarum strains in general and noticing a reduction in symptoms. So this is something to consider when you need additional tools to help with managing symptoms. When hydrogen sulfide SIBO throws your gut off balance, there are strategies we can use to support digestion and help restore normal function. Let's dive into digestive supports. Digestive supports are a part of phase 1 of our SIBO framework. And while they are listed as number 4, remember that we are layering these in at the same time as the other elements of diet and antimicrobials. SIBO can interfere with your body's ability to produce digestive enzymes, especially those made by the brush border of the small intestine. This can lead to undigested food in the gut and contribute to excess fermentation and gas. That's why we often recommend supplementing with digestive enzymes to support proper digestion. One product that many of our clients find effective and that's really well tolerated is Enzymedica's Digest Gold with AT Pro. Supporting digestion goes beyond just what you eat. It's also about managing stress and incorporating daily relaxation practices. These simple daily habits are crucial for boosting blood flow to the GI tract and enhancing parasympathetic tone in the enteric nervous system, which is the nervous system in the gut that aids digestion. When your body is stressed, it prioritizes functions like sending blood to your muscles for fight, flight, or freeze over digesting your meals. To counter this, taking a moment to relax before eating can make a big difference. Many of our clients find that taking a few deep breaths and focusing on the flavors, textures, and chewing of their food helps signal to their body to help prioritize digestion. When it comes to our SIBO framework, detoxification and managing diet symptoms are an important part of the process. So we have added it into our digestive supports element. Molybdenum is a trace mineral that plays a key role in detoxifying hydrogen sulfide gas, helping to reduce its harmful effects in the body. This is particularly important for managing hydrogen sulfide SIBO, where symptoms like brain fog, fatigue, and digestive issues can worsen during die-off. Our clients typically add up to 1,200 micrograms of molybdenum daily to help support the detox process and ease die-off symptoms. But more generally, when bacteria die off, they release toxins into the gut, triggering an immune response that can lead to what's known as die-off or Herxheimer reactions. Common symptoms include fatigue, headaches, body aches, mood changes, and increased GI discomfort. To help manage these symptoms, we suggest the following strategies to our clients. The first is slow titration, so gradually introducing diet changes and supplements to control the rate of bacterial die-off. Second is reduce inflammation. Get plenty of rest and include anti-inflammatory, antioxidant-rich foods like omega-3s in your diet. And third is support detoxification. It's really important. You need to enhance detox pathways, especially liver function, with foods, herbs, supplements, and binders as you need them. Supporting the liver is essential in the gut healing process and can significantly reduce die-off symptoms. For more detailed guidance, check out our blog post and grab our free die-off e-guide linked below in the description. The final part of digestive supports is looking after motility in the small intestine. So one of the best tools that we have to support small intestine motility and prevent SIBO relapse is prokinetics. Prokinetics work by stimulating the migrating motor complex, the wave-like contractions that occur every 90 to 120 minutes to clear out excess bacteria and food from the small intestine, helping to prevent recurring bacterial overgrowths. When the migrating motor complex, also called the MMC, isn't functioning properly, it's really hard to eradicate SIBO, and even if you do, there's a high likelihood of relapse. This is why impaired small intestine motility is a leading cause of SIBO relapse. Studies show that about 2/3 of SIBO cases relapse, and often within about 2 to 2.5 months, especially when underlying causes haven't been properly identified or addressed. It's worth mentioning here that prokinetics don't replace the MMC. They enhance the effectiveness of vinculin motor proteins in the MMC. If the proteins are significantly damaged by severe food poisoning, as an example, prokinetics might not be effective. You need enough function to have something to boost. But outside of this scenario, they are incredibly helpful. We typically add in prokinetics during hydrogen sulfide SIBO eradication to see if they improve symptoms and to make sure that they are tolerated. We aim to have motility supports in place before the end of phase 1 and recommend that clients continue taking them for at least 3 months to get through the critical relapse period. Some clients may need to continue using prokinetics longer, and that's perfectly fine. Personally, I used them for 2 years after eradicating SIBO until I felt safe coming off them. There are many prokinetic supplements available, but we prefer ginger root or combinations that contain ginger. For those who don't tolerate ginger, then Iberogast, a blend of 6 herbs, has been shown to improve MMC function. So these are the basics of phase 1, the eradication phase. We are going to cover phase 2, relapse prevention, in a separate video, so make sure you're subscribed with notifications so you don't miss it. Addressing hydrogen sulfide SIBO, or intestinal sulfide overproduction, as it's been recently renamed, is a complex journey. Not only do you need to address the bacterial overgrowth, but you also have to manage sulfur metabolism, which adds another layer of complexity. Our gut health and microbiome are constantly evolving, influenced by factors like diet, lifestyle, and previous eradication protocols. That's why a personalized approach is essential. At the Functional Gut Health Clinic, we've successfully guided hundreds of clients with tailored strategies for hydrogen sulfide SIBO. If you suspect you have SIBO or you've tested positive and need expert guidance, click the link in the description to connect with one of our SIBO specialists. Let's work together to take back control of your gut health.